Hello, and thank you for inviting me today. Hope you're learning a lot from the fair. Um, I'm Camila Arnaudo. My information is here on the screen. I am a psychiatrist. I'm a perinatal psychiatrist. I take care of people who are pregnant and postpartum who have mental health and also addiction-related illnesses. And I'm co-medical director of the Indiana CHAMP program, which is a no-fee phone consultation line for prescribers in Indiana. I'm going to show some slides today, and these were actually created by Erica Goyer. Here's her information. She's a person who uses drugs, and she works for the Academy of Perinatal Harm Reduction and creates a lot of wonderful materials. And we have presented some of these slides at a recent conference. So here we go. All right. So I'm going to talk to you a little bit about drug use and substance use disorder in the perinatal period. I'm going to talk to you about this because the perinatal period is a time when the time when people are likely to be being pregnant, that those are ages when people are also more likely to be using drugs. And it just intersects in what a famous researcher named Mishka Turplan calls the pregnancy box. So it's a time when people are likely to be using drugs, but once they become pregnant, they have this high motivation to try to stop using. So it's a particularly important time to try to intervene with people and help them to make some changes to their habits that can lead to long-term recovery. But as we're going to learn, it's also a time, especially the postpartum period, is also a time of really great risk for overdose and death for people who use drugs. In particular, opioids are an important focus, although predominantly people who use drugs during pregnancy and postpartum are using multiple drugs, so it's called polysubstance use. But opioids are particularly important in terms of overdose, and they're also a substance for which we have some really good treatments and validated treatments that we want to utilize whenever possible. So it's one of the reasons we're going to talk about this particular substance today. And also, we have a special relationship with this plant. Humans do. In the United States, in particular, women and opioid use have been linked for a very long time. We had laudanum, which was a mix of opioids and alcohol in the past, and it was used for things like menstrual pain, morning sickness, diseases of the nervous character, and other female complaints. And a lot of people were using these, and they did become, dependent on them. And opioids have been described by people who use them as feeling like love, and by which it means that we have these receptors in our brain that where endogenous opioids bind, and these feel like euphoria. They can make you feel like you're being your anxiety, your dread, it all goes away. This is from an article here on the right, which I encourage you to check out. But Maya Salavitz, she's a person in long-term recovery who writes really beautifully about her experience with opioids. But she's also a researcher about the brain. And so her writing really gives you some good insight into what's happening in the brain. So we've had this long-term relationship in the United States with opioids. We've gotten to a point of crisis with people using drugs and maternal mortality being highly affected by this. And the response that we've had has been to criminalize, to prohibit, to do a lot of family surveillance, to take people's parental rights away. And what this is leading to, instead of a decrease in drug use, is actually a worsening crisis. It's leading to suicides, overdoses, and also what are termed deaths of undeterminate intent, when we're not sure if the person was, purposefully trying to harm themselves or if it was an accident. And these are all articles, and you have the QR codes there in case you want to read these articles yourself. But maternal mortality is increasing still. Well, it was increasing during the pandemic. It's starting to go down a little bit in Indiana, but we don't have like a rapid downtrend. And because of the way we've dealt with the crisis, there's a lot of stigma. people who use drugs have stigma already, but if you're a pregnant drug user or a mom who uses drugs, you're particularly impacted by an additional level of stress and stigma. And what this is leading to in Indiana is an increase in maternal mortality due to overdoses, in particular in the late postpartum period, as you can see here. And also, as you can see on the figure on the left, the rate of death of maternal associated deaths associated with overdose is by far and away the most likely cause of this death, much higher than embolisms or cardiomyopathy or any kind of medical complication that you may think of. And why does this happen? And like I said before, pregnancy is an time of opportunity, and you see here that drug use tends to decrease while people are pregnant. But then in the postpartum period, all kinds of stresses come into play. People who were not able to start facing problems with criminal justice. Even if they did stop, there may still be drugs found in the baby's system from the earlier exposure. So now they've stopped, but the children are still removed through the Department of Child Services in Indiana, and this can increase the stress significantly for people. Also, they may be expected to return to work and not have childcare. They were expecting that things were going to get easier when they had their baby, but many times it can get harder. And so again, all these stressors increase the risk that people will start using drugs again. And that's what we see in this study, but also in other studies, that both fatal and non-fatal overdoses increase in the postpartum period. So what's happening for people when they use substances? In addition to feeling like love, people do develop tolerance and dependence. So trying to be drug-free or to not use any opioids is very difficult because the equilibrium in the brain has changed. People are adding more substances, then they stop using during pregnancy. And when they stop using, their tolerance goes down and they're at higher risk. And in order to kind of protect people from using short-acting opioids, we have some what's called MOUD. So these are long-acting opioid, either partial or full agonists. So these bind to the opioid receptors and they decrease cravings. They make people feel normal again, so they can go on with their lives. They can work, they can take care of their kids, and they can avoid using drugs, short-acting drugs like fentanyl or heroin that require them to go into much riskier situations to obtain them. And these treatments are recommended for pregnant and postpartum people. Methadone has been the gold standard treatment for many years. And so instead of criminalizing and instead of prohibiting, what we should be doing is encouraging people to access these treatments. And they are available to people in Indiana. We have both obstetricians, psychiatrists, nurse practitioners, family medicine providers, all prescribing these medicines. And what we need to be working to do is increase access. So as I said, when you use MOUD, what it feels like is you feel stable. People say they feel normal. They don't have to worry about trying to get drugs every day. It is not a way to get high. And when dosed appropriately, people don't feel high. They don't look high. You wouldn't even be able to tell. There's probably people walking among you right now on these meds and you can't tell. This is just a chart to remind everyone, these are the various forms of MOUD that is available. That's at the top. And then at the bottom, we have naloxone, which I'm going to talk a little bit about that next. So MOUD is one form of harm reduction. Other forms of harm reduction that you may have heard about are things like wearing a seatbelt or a helmet when you ride your bike, or another form of harm reduction is saying, when I go out to drink, I'm only going to have one drink, and you go out with a buddy and you guys kind of hold each other accountable. That's a form of harm reduction. And these are all catchphrases that go along with harm reduction. It's really like meet people where they're at, any positive change, and it's a supportive way to help people stay alive. Overdose during pregnancy and postpartum, like I said, is a huge risk. And so we want to make sure all of us are educated. We're all carrying naloxone. This is a QR code that you can go into and obtain your own naloxone so you can carry it. And this is a line, because if you're carrying naloxone, it's not going to work very well if you're alone. So we really want to encourage not to use alone, but many people find themselves in situations where they are using alone. And if that happens, this is a phone line that you can call, and they stay on the line with you and they talk to you, and they even have like a video version where they can watch you. And if they see that you're nodding out with your permission ahead of time, you establish permission, and then they can call for help if you need it. So this is a video that I encourage you guys to take a look at. It gives more details about how naloxone works in the brain and how it can prevent people from overdosing. There's nothing special about naloxone in pregnant people. The only difference is when you bring them back, you would put them on the left side to put less stress on the on the on the baby and allow more blood to flow through. But other than that, you're still doing rescue breathing. You're still using naloxone. This is a short video, so I don't have time to do the full training on naloxone. But this is a toolkit that the company that Erica works with, which is the Academy of Perinatal Harm Reduction, has put together. It has images and training of how to use naloxone in there, and also has other things related to harm reduction that we want to encourage people to learn about. The work of harm reduction really is to speak up, be curious and not judgmental, share the evidence that we do have, promote safer use, and meet people where they're at right now. So thanks so much for listening to my presentation. I hope it was helpful. My information's in the first slide, so please contact me if you have questions, and I'm happy to give additional resources if needed.